The question is about radiology, how a radiologist may interpret certain things on an X-ray that a chiropractor will not, or a chiropractor will see things that a radiologist will not. And that's a really interesting question. I work at the Queen Elizabeth Health Complex. I send my patients who need X-rays to the radiologist downstairs. I get the X-rays back with a report. And I always put the report aside when I look at the X-rays. I make my own conclusions and then I look at what the radiologist says. And I would tell you the biggest difference is that a chiropractor, although obviously interested in pathology or degenerative changes, a chiropractor is also very interested in the mechanics of what the X-ray shows. So a very classic example is a reduced cervical curve. A radiologist may see a reduced cervical curve and not comment on it. No big deal. But for a chiropractor, we look at a reduced cervical curve and say, okay, we have muscle imbalances here, we have reduced joint function here. This patient is probably going to be more prone to developing osteoarthritis at a more rapid rate. So it's really in the mechanics, I would say, is the main difference.